name is Lauren Rader, and I'm going to be doing my toddler assessment on my frog. So we're going to start with general appearance. Is Froggy progressing the way he should for his developmental stage? So I'm looking at his behavior. Is it appropriate? Is his posture appropriate? Is he clean? Is he dressed okay? Is he taken care of? Vision, speech are also noted, and he's responding appropriately and hearing me appropriately, and also reacting appropriately to my responses for the developmental age. So we're going to move on to nutrition status. Froggy has nice, even hair all over his body, and he also has no dry skin. It's very smooth, it's very pink, it's very nice. And the visual weight seems to be a bit more obese or overweight than usual, but Froggy does have a little bit of weight on him. So we're also going to move to head. We're going to check if there's any pain in the head. We're going to check and see if all the features are symmetrical. So Froggy's eyes and his snout, nose, are equal, and everything is looking good there. Everything is symmetrical, nose, eyes, ears. What he has of ears, they usually have little holes, but they are symmetrical as well. We're checking for any drainage or abnormalities, and I'm not seeing any eye drainage, no drainage from the nose, no lesions, no bruising. We're also looking at the skin when we're talking about the torso. Seems to be, he has a bit of vitiligo going on, so that is something we would know for skin as well. There are no lesions, bruising, anything like that. Just making sure that he is all good in that department. So I'm going to listen to my bowel sounds here. So we're going to set Froggy down for a minute, and we're going to listen to bowel sounds. Yep, doing it fast, just so it's good. Bowel sounds are all equal and active. We're also going to listen to lung sounds as well. So we're going to move in these quadrants down like this. And lung sounds are equal bilaterally, no adventitious sounds. And we're also going to listen to the heart. So we're going to listen to that PMI, which is the point of maximum intensity, I believe, which is the apical impulse. So we just want to hear and make sure that his heart has a normal rhythm and there's no murmurs or anything, and normal sinus rhythm is detected. I do not hear anything irregular. S1 and 2 are intact normally as well. So we're going to talk about his extremities now and talk about range of motion. Froggy seems to be able to move his extremities very well. He squeezed both my hands on both sides, very strong, +5, and also foot pushes and foot pulls back are intact, +5. Hands, feet, and joints do not seem to have anything going on with them that are weird. Everything seems to be intact there, and mobility is very strong. So we are going to talk about palpation as well. So I'm going to be feeling around on Froggy to make sure everything is good. So there's no abdominal distension, everything is round and soft. There's nothing that I can palpate to feel, and there's also no pain with palpation as well. We want to find any inflammation, any tenderness, and any masses that we could find. So we'll also make sure that there's no inflammation in the lymph nodes, so we palpate all those lymph nodes, which Froggy has different lymph nodes because he's a frog. Vital signs would be for heart rate would be 70 to 110, which is normal, and then respiratory rate would be 20 to 30. And then blood pressure would be between 90 to 105 to systolic over diastolic, which would be 55 to 70. And now we're going to do the most invasive, which would be the genital area. So making sure that all these genitals, or that the genitals are normal, they're equal bilaterally, making sure there's no enlargement, there's no inflammation or lesions present, and everything looks good for Froggy. Although he does have his tag right here. So that is the end of my head-to-toe assessment. Thank you very much, and I appreciate you watching, and I think Froggy is feeling good about his head-to-toe assessment. Thank you.